You're welcome to another exciting episode on Lagos City Pulse. And today we'll continue the discussion on primary healthcare delivery across Lagos State, which is very important for the development of our communities and grassroots. And we have very sound men, authorities in this field that we'll be talking to as our guest on the program. First of all, let me introduce the already popular face on Lagos City Pulse, that is Reverend Joe Iyitegbulem. He is the Vice Chairman of Association of Practitioners of Community Media in Nigeria, APCOM, is the Vice Chairman. Reverend is also the publisher of Oshodi Post newspaper. Reverend is a decorated champion of women and children health by the Lagos State Ministry of Health, and is also qualified to speak on primary health in Lagos State, which is community health delivery services. You're welcome to the program, Reverend.
Thank you very much. Good to be here again.
Okay, and we also have Comrade Abiodun Ajayi. Comrade Abiodun Ajayi is the Executive Director, Public Health Sustainable Advocacy Initiative, PHCs. Comrade Abiodun is a youth development advocate and executive director of Public Health Sustainable Advocacy Initiative. He leads grassroots campaign on climate action, that's SRHR, and community resilience. Comrade Abiodun engages in policy advocacy, youth representation, amplifying young voices in environmental and public health spaces across local and international platforms. So you're welcome to the
Thank
program.
you
also.
very much for
Thank you
having
very
me here.
much.
Thank
Comrade,
you.
good to be here.
Thank you very, very.
It's nice. So let's get into the business of the discussion. It's a continuing discussion. We have had some speakers already, and we are having them also, because health is wealth. And those, like one of our guests said, that there are two factors that make people have sleepless nights: wealth and health. And so that's what we're going to be discussing this morning. So let me start with Reverend. Um, can you explain the concept of primary health care and why it is crucial for communities?
Thank you very much, Mr. Yomi. It's good to be here again. Primary health, the concept of primary health delivery system is giving health delivery system to the community and making them to own it. They know the doctor, they know the nurses, they know their schedules, they can go there at any point in time, and it's very close to them. So this primary is what it's all about, and that's why it evolved from federal government to state and local government. These three principal sectors play critical roles. The federal government may bring in the drugs or partners, the state building the structures, the local government manages it, and the community where it is situated, make sure it works. So the concept is to bring the health delivery system nearer to the people, to the grassroots.
Okay. So, Comrade Biodun, what are the biggest healthcare challenges faced by residents across communities in Lagos that you perceive are the biggest challenges faced by residents?
Okay, thank you very much, the host, for having me here again. In as much as we commend the Lagos State government for their effort in bringing, primary health care centers to the people. Let's go statistically. We have over 300 PHCs in Lagos State, and these PHCs are providing services they are expected to provide. And with the help of donors too, let me also mention that with the help of donors, we have been able to also bridge some little gaps, except the fact that, yes, while some PHCs are delivering those services, some are still facing that, gaps of lack of infrastructural development, not lack of enough consumables. And even staff attrition is also a challenge. So for the people who access this facility, what are the biggest challenges they are faced with? Yes, they are faced with, yes, number one is the infrastructure. When the structure is not good enough to provide them that friendly services that they deserve. In Lagos State last year, during our survey, we discovered that we were told, we read in the news, it's not something that is new to people who stay within that community. I don't want to mention name. A facility, while and heavy rain was falling, a facility was flooded.
Mm.
It was flooded, and
Mm.
it nearly took the lives of a pregnant woman at that facility. So these are some of the challenges. So for a pregnant woman who is faced with that challenge, do you expect her to get to that facility again the following day? No, she'll find a safe facility. It might not be PAC, it might be private, and then get enrolled there to say that, oh, I don't want to lose my life. I don't want to lose my life. So let me go to where I'm going to, get quality health services via their, vis-a-vis the infrastructure development and other things. And the staff attrition too. We also faced with this challenge. Even me, this year I had typhoid, and I visited a PAC in my area. When I got there, the doctor attended to me in a rush because he was going home. I got there to 4, and he said his closing time was 4 p.m. And he said I should answer him. I should say everything that he didn't even ask me to do any scan. He just said, I know what is wrong with you, and he make prescriptions, and that was all. So if there were enough doctors who would take over from him while he's leaving by 4, I think we should be able to get the quality health services that we deserve. And also out of pocket, money or fund is also a big challenge, where you get to a facility and then from desk to desk, you start making payment. You pay for this, you pay for somebody who is poor, who is from a poor environment, and you're asking such person to pay 10,000. And then before she left home, she was told that services are free over there. And when you get there, they start asking you to make payment for all of this. So these are challenges that our people are facing. And then consumables, when you get to a facility and they will tell you, we don't have cotton, we don't have this, we don't have that. Not enough consumables is also a big challenge, where people, start making so many comments to say that, okay, if the PSC is not providing this for us, it is better I switch to a private facility. You don't blame Lagosians or people generally who are accessing private facility. Why? Because they believe that going to that private facility, they will see or get everything that they desire to see in the PSC that they are not seeing.
So in your experience, comrade, I still remain with you. Your experience, how well are primary healthcare facilities equipped and staffed in Lagos State with what you have just said?
Oh, so let me comment. Let me still commend the state government. See, in as much as we can identify gaps, we also need to identify successes too. That's the honest truth. Lagos State is also doing well in support of the donors. But I can tell you again that we still suffer gaps, challenges in our infrastructure at some PACs. Just before before we started this conversation, I shared a local government with you.
Yes.
That you can't go to that PAC and then not be angry with the chairman of that local government. The health facility is in a bad state. Even where they are supposed to admit people is not even good enough to see. Cobwebs is there. Cobwebs are there, are scattered all over, the facility. And even the bedspread is not even good enough to sleep on. And this is a primary health care center that people in that area also, visit. They also depend on it because primary health care center is expected to cover some number of people. So the infrastructure is not really, really good enough. And I can say again, why the donors are making effort to get people to the center, why they are also making effort to also help us take care of some area, maybe commodities and consumables. The government should do more around funding the infrastructure, ensuring that they do more around infrastructure, make it more friendly for people, make it more, accessible for people.
Okay, so Reverend, have you observed any community-driven efforts aimed at improving primary health care in Lagos?
There are many. mostly, if you look around, let me even take Oshodu as
Because that's your
when
that's your base.
when you say community, you are saying things done outside the government, Abi, and or government sponsored with the help of the people or in conjunction with the people. When I was talking before, I forgot to say that one of the main reasons of primary health care system is to reduce small illnesses getting to the tertiary medical centers or institutions, so that you don't go to last week to the hospital and see a lot of people talking of malaria and typhoid, which could be handled there, or pediatric issues. So that is one of the main core. And for example, for Oshodi, if you look at Oshodi, about say 3, 4, 5 years ago, there about Ajibulu, Ogulan, or maybe about 3 or 4. But you find out there are about 7 or 8 now. All those things, House of Assembly people brought it, this person brought this. And some of the time, the community and the donors should go and do shares. Sometimes take ownership, paint. And not only that, immobilizing the people. They are doing immunization, or you see the CDA leaders telling people and all those. So to me, these are part of the things the communities are doing to make sure that that primary health center in their community
is well strengthened.
Yes, and it deserves the services, deliver the services it was brought for.
Okay, yes. Thank you very much. So, comrade, I'm coming back to you. From your interactions, what are the common misconceptions of lack of awareness among residents about primary healthcare services from relating with the people?
Yeah, this is a very popular, it's a popular menace. And, it has also discouraged a lot of people in accessing PHCs, where, somebody visits that facility and most likely too, these are influential people in their community. So when they don't get the services that they deserve, they go back to the community and start telling people, if you go there, you won't get the service that you need. They only have one doctor servicing more than 100 people visiting the center. So how would somebody risk his or her life by going to such facility? So it's a really it's a big gap for us, or for PHC, let me put it that way. And that is why you see that people who are having headache, they are rushing to general hospital, not primary health care center. Why? It's because of this misconception. The traffic is driven to general hospital, and general hospital is a tertiary.
Yes.
Is supposed to be providing high level, services. If you're having malaria, you're having typhoid, you're having headache, you should go to primary health care centers. So even what we are seeing in the PAC is not even also attracting people to come. So it's a really big gap. And then even without people having that misconception, what they see at the center by themselves is also, driving them away from the center.
So let's move a little bit and look at this. COVID-19, the pandemic, you understand, it came, and how do you see how has it influenced delivery and perception of primary health care at the grassroots level?
So COVID-19 really helped us a lot, and I can put it that way. In as much as some of us were not happy with, the outcome, the result that it brought, but the outcome of it is just that people now are now very conscious of themselves. Very conscious. They will tell you, in those days, people don't really value wash your hand before you do this. So COVID-19 also helped us, get familiar with all of this. And even till now, if you go to any primary health care centers in Lagos State, you will discover that there's still this poster that talks about COVID-19. So it helps drive people to start, to start being conscious of their health. And then, if you are thinking about being conscious of your health, the first thing that comes to your mind is, okay, where can I go to get these services? It drives you to the healthcare center. So it was really an eye-opening, and it was an avenue for people to start paying attention to their health, and it also helped attract more people to the healthcare centers.
Okay, so Reverend, as a community media practitioner, what improvements would you like to see in primary healthcare access and quality in Lagos? What improvements?
I think it's a continuous assessment. But first and foremost, I was with the permanent secretary for District 6 the other day, and this issue came up. And she was saying, because one of the major challenge in primary health care delivery system in Lagos State is this issue of staffing. They say most doctors are leaving. And but sometimes when I look at it, it's not that they are leaving. There are more and more people demanding that service. If you go to Oshodi 10 years ago, Oshodi is 1 million, now it's 1.5 million. So there are more people demanding those services. So the Lagos State government must do something about it. The woman was saying that, there are more interviews, recent interviews for medical doctors. So they must improve in the number of medical staff. Very, very, very important. Like the comrade was just saying now, if somebody go there, queuing period, queuing to receive service in primary health is very large. It's too long. So they must do something to bring more staff to the primary health care delivery system. Then secondly, I see a lot of development, expansion, and so on and so forth. But let me say something. They must fight this misinformation. They must fight the misinformation. They must also educate more their staff on courtesy. Because they are few doing so many things, don't say they're very aggressive and what have you. And I want to say something here. Please, I want to be quoted. Lagos State is delivering services to everybody living in Lagos. Most often, when you go to the primary health care centers, go there, everything is delivered in Yoruba. Feel like say, go. And when you get to that town, outside is there. So go and find out. You hardly see none other Igbos in primary health centers. I saw a case. I met a lady that has a baby. The baby, they are twins. They are about 9 months. So I was sitting with her, and it was raining in the primary health center. I asked her, have you started your family planning? She said no. And that woman has been coming there. How come nobody has ever educated her? I said, are you awake? And he said, you quickly carry the weight inside. That means maybe most of them didn't even hear all what they were saying. These issues should be addressed.
Thank you very much. And so, you've made a lot of valid points as regards primary healthcare center. So, comrade, what strategies do you think could increase community participation and trust in primary healthcare delivery?
So I think this is one of the things that we have been doing at our own level as CSOs in Lagos State. So we've been strengthening the capacity of community gatekeepers. And Reverend Joe is one of those gatekeepers which you also identify with just now. Is a World Health Committee member in Oshodi. He is a champion in Oshodi. So these are people that will build their capacity. We train them. We give them the data that they need. We give them the orientation that they need. So we make them champions so that they can go back to their community and start creating awareness about it. You can't count the number of people he can reach in his community, because I don't reside in that community. He resides there. So he knows who and who should be talked to. And that is what we have been doing. And we also identify with other structure in the community. We have the LGHA, the Local Government Health Authority. As a matter of fact, it is only here that we don't, the chairman in Lagos State, I'm actually calling on the incoming chairman of different local governments in Lagos, because I know election will be coming up next week or next 2 weeks. I'm calling on them to start strengthening these structures. When you strengthen them, it will lessen the burden on them. The LGHA are supposed to be the driver of the PHCs. Yes, they are supposed to be the drivers. Drivers that I mean, when there are issues in the PHC, they report to the chairman, and the chairman, make case on it and then do something about it. So we are also working. We when we do our research, when we do our capacity building, we engage them, we build their capacity, and more often we allow them own it. Owning it means that yes, we got a fund from this donor, we are implementing it, and we are allowing you to own it, so that when we leave your community, you can proceed with it. And we have had quite a number of organizations. We have had the Challenge Initiative, who have been going around local government, sensitizing people, doing outreaches. We have seen Pathfinder International building capacities of women to be the voices, and then more often too, we need to scale up engagement with indigenous media platforms. We are missing it at that level, and this has been my preaching, or this has been my focal, discussion at many roundtable conversation, that it is high time we start looking at the local, indigenous community news. Yeah, TVC is there, LTV is there, but meanwhile, how many people are, large number of people are watching TVC, but they are scattered. But we have people who have cordial relationship or who are very familiar with their local news. They have a WhatsApp group that they drop their links. So when we start engaging them, they can also help us, populate or propagate, help us expand our news, and then so that to reach the voiceless people, the people who really need this information. So I think at that level, we'll be able to get this misconception, eradicated or, brought to, to zero. So I think more and consistent, outreaches and awareness is also very, very, pivotal in this program.
Okay, thank you very much. We will not end this edition without getting one success story of primary healthcare in Lagos from both of you. Let's start with you. Which one can you easily remember? A success story of a primary healthcare and delivery system?
There are so many to talk about, but when you say Lagos is large, maybe you are talking to me, maybe you are talking about Oshodi, maybe even talking of Interfaith, Public Health Advocacy, where I'm the General Secretary, or are you talking about my own PHC, which I'm the World Health Committee? There are, before we
give us one success story.
Before we have a community health center in Ogoloka, and they say it doesn't belong to Ogoloka ward. When you go there, they are doing all like this. But the last 2 years, now we have Ogoloka primary health care.
Wow.
Inside the Oshodi Solo local government, we have the World Health Committee.
Wow.
And not only that, it is so modernized by the current chairman and the donors. CCRs and all those. It's easy. And the good thing about it is that a lot of people go to local government for other things. So it's easy for them to go there. It's different from the staff clinic, where only staff go. So to me, it's critical. Most of the things happen in that local government secretariat, meetings and what have you, football field. So there's a primary health care center of Ogoloka Primary Health Center. So to me, I want to say everybody, clap for Ogoloka.
Thank you very much. Thank you. And so a success story from your own end as an health advocate, grassroots health advocate, vis-a-vis partnership with primary healthcare centers and government and donors. Which one that really comes to mind that it makes you happy when you remember that, yes, we're able to do something?
Okay, the one that, yes, thank you to Dr. Reverend Joe. The one he talked about was during a women's health project last year, where you share it on Facebook, and you were invited by the chairman. So it's a success story, and we were funded by Pathfinder that year. One that really resonates in my heart often is the one that we had in 2019. We visited I initiated a meeting with the First Lady of Lagos State, Dr. Mrs. Ibijoke Sanwo-Olu. And what was our discussion with her when we met her? It was a 10-minute discussion. We told her we need a dedicated budget line for adolescent young people in Lagos State, more important, adolescent and youth in Lagos State. And we tender, because we at PHCs, we don't work without policy brief. We don't work without advocacy brief, because it is there. We have our facts and figures. So when you see it, you know that this is an issue. So we appeal to, can you help us talk to the governor to at least help us create a budget line for young people? And few weeks after, maybe when they were doing the budgeting, we also presented it. And as I speak to you, in Lagos State, there is a dedicated budget line for adolescents and youth, which is 50 million naira. So until today, it's still a budget for the adolescent department in the Ministry of Health. So it's a big success story for us at PHCs. We have so many, but this one is something that I drive intentionally. And I'm so proud that this came to life.
Wow, thank you very much. I'm sure this episode has been very exciting and very educative. I will continue to push the narrative about the primary healthcare center And we hope you stay tuned with us. You follow us on our social media platforms. And this, like I said, is Lagos City Pulse, where we look at the heartbeats, what are the issues and the grassroots in our communities, and bring it to the view of the general public. Thank you for coming on the program. Thank you for being with us. We'll see you in our next episode.